Hi, I'm Clare Schexnyder, and I'm the owner and founder of Oh Baby Fitness. And we offer exercise classes for new moms and expectant mothers. And I'm also on the board of Postpartum Support International, our Georgia chapter. And I'm here today to talk about the importance of exercise during your pregnancy and postpartum. And it can help you so much in avoiding depression. I know especially I am a survivor of postpartum depression. When I had my baby 13 years ago, I had a terrific case of postpartum depression where I didn't want anything to do with my baby. But I'm a control freak, so I wouldn't let anybody else touch him either. And I didn't know during my pregnancy that I was at risk for postpartum depression because I'm a real type A personality. I like to schedule everything, and I loved my sleep. I didn't always get enough sleep, but when I wanted to sleep, I got a lot of sleep and really loved it. And those two things, loving your sleep and trying to schedule everything and everybody, are real risk factors for putting you at risk of postpartum depression. I didn't know that going in, and I made the bonehead move of telling my parents that I didn't want them to come down after my baby was born. I wanted to bond with my baby on my own, just my husband, myself, and my baby. Terrible, terrible move, because what happened, I got sleep deprived, and I couldn't schedule that baby, and my baby was colicky, and he wouldn't sleep for more than 30 minutes without waking up writhing and screaming. Turned out he had a dairy, nut, and soy allergy, of course everything I was eating, but that just pushed me over the edge into the pit of postpartum depression. And the funny thing is, when you have postpartum depression, you don't know you have it. You could even know all the warning signs of postpartum depression before you have your baby, but it's strange. You are in a hole and you don't know what's happening to you. And I actually worked at CNN prior to having my baby, and I had done a story on postpartum depression, and I knew all the warning signs. Couldn't sleep, didn't want to have anything to do with my baby pretty much, had trouble eating, I had trouble breastfeeding, all of these warning factors, and I couldn't stop crying. And I started having some seriously scary thoughts. And all of those things were sort of warning signs, but when you're caring for a new human, you just don't know that something's wrong. And so it was really important that a friend took me, after about 3 or 4 months of awfulness, took me to a new parent support group. And I wound up meeting some other moms and dads at that group, and they asked me to go for a walk every day. They were really tenacious. I didn't want to go, wasn't really interested, but they kept calling. I went, and that exercise that I got, and one of the moms in the group said that she was suffering from postpartum depression. And I asked her, I was like, what's that like? And she said, I'm not sleeping, I'm crying all the time, I really just don't want anything to do with my baby. And she said that she went to her doctor, and her doctor gave her some Zoloft. And so I called my doctor, and I got a prescription for Zoloft. And my doctor said, I knew it. I knew that at your 6-week appointment you fooled me, that you probably had all the signs, but you put on a good show, and I missed it. So with that Zoloft and that exercise and those new friends I made in that support group, really saved my life. And I was able to see that something was wrong with my baby, took him to the doctor, and he was diagnosed with that dairy, nut, and soy allergy. And I changed my diet and breastfeeding. I got the hang of breastfeeding. And what happened was I got a lot of help. And I got a lot of exercise. I got out of the house for the first time. And all of those things started to really come together to help me get better. And exercise was such a lifesaver. And I didn't really understand what a lifesaver it was. But I quit my job and I started my business to offer pregnancy and mom and baby exercise classes because I knew that exercise could be a real lifesaver, and I wanted to give every mom an opportunity to be part of a safe fitness class and have an opportunity to have that community with other moms that could be so life-saving. So I have learned a lot about exercise and its effects on pregnancy and the postpartum period. When you're pregnant, exercise can basically solve every complaint that you have in pregnancy. If you have swelling or constipation or you're not sleeping well, exercise can help all of those things. The American Congress of Obstetricians and Gynecologists actually says that you should be exercising 150 minutes a week when you're pregnant and postpartum. And the rule is that if you've been exercising before you were pregnant, you can continue exercising, just doing the same things that you were doing. And you can actually increase your intensity during your pregnancy. And so and it'll make you feel so much better. If you never exercised before you were pregnant or didn't exercise very often, start exercising at a gradual pace. Make sure you see your doctor or healthcare provider to say that everything's okay and that there's anything that you need to be concerned about. As far as perhaps high blood pressure or a heart issue or anything like that. You want to just make sure that you don't have any of those problems before you go into exercising. But get started. Exercise is going to help you avoid depression during your pregnancy, and it's going to help you with your posture and carrying the baby and getting fit. It actually will help you have a faster delivery and a quicker recovery. We all want that. And smarter baby. Actually, exercise can help strengthen the placenta, and the baby will get more oxygen with a stronger placenta. And that's what we all want. More oxygen enriched blood will make your baby smarter and help them grow. So all of those things, exercise is excellent during your pregnancy, and I could talk all day about it. Afterwards, it's even more important to exercise. And there are studies that show that women who work out in a group with other women actually lose more weight and keep it off longer than those women who exercise alone. And there are studies that show that exercise can actually combat postpartum depression better than medication sometimes. So the first thing you need to do is, I'm going to show you 3 exercises that you should do right after you have your baby. But then you should also get outside, go for a walk. You could wear your baby in a carrier or put your baby in a stroller, but get moving as soon as you can. And again, the American Congress of Obstetricians and Gynecologists actually says that women can go back to exercise a lot sooner than previously thought. You can start back with gentle exercise that feels good. As soon as you've had your baby, you can start going for a walk. If you really want to not do vigorous exercise until you stop bleeding, and oftentimes that's a couple weeks after pregnancy. If you've had a C-section, you're really going to need to be careful of your C-section scar and make sure that that's healed. That's major surgery, so you want to make sure that you've healed. Definitely take a couple of weeks for that. But here are 3 exercises that you can do pretty much as soon as you've had the baby. The first ones that I'm going to show you, you can actually do in the hospital if you've had a vaginal birth or a C-section. You just want to, the first thing you really want to do is a Kegel, and know how to do a Kegel exercise. Kegels are going to help you heal and get that pelvic floor rehabbed so that you can avoid incontinence, and it can just help everything get back into place. So to do a Kegel, you want to think about the Kegel as a big muscle. It's the size of an 8.5 by 11 inch piece of paper, and it goes from hip to hip and pubic bone to tailbone. And so it's a big muscle, and you want to make sure that you're just pulling it up. You have to find it again after you have your baby. You want to be able to find that pelvic floor and draw it up and then release it. And a really good time to do that is when you're feeding your baby. Your uterus is going to be contracting right after you've had your baby to get the blood out and to get your uterus back to the normal size again. Doing those pelvic floor lifts can really help to just strengthen, help you find that pelvic floor and start to rehab. So when you're feeding your baby, if you're breastfeeding or bottle feeding, do a few Kegel lifts and just try to find that muscle again and lift it up and hold it and then release it. That's a really good exercise for just right after you've had your baby. Another one is you want to try to pull your belly button into your spine. And you just want to do some deep belly breathing. So filling up your belly with air when you inhale. And then when you exhale, pulling your belly button to your spine. Doesn't look like a lot, but it's hard to do it first. And that simple exercise can help rehab your transverse abdominals and just help you get your core back in shape. And a lot of times we're so stretched out after pregnancy that just that deep belly breathing, if you've had a C-section or not, deep belly breathing, filling up your belly with air, and then exhaling and pulling that belly button in and holding it, that's a huge exercise right after you've had your baby. And then that's just something that we want to continue to do as your baby grows and you continue to rehab. You just want to pull that belly button into the spine. That's going to strengthen your abs and get you set back up for exercise. And then the other thing that we want to do that helps really avoid depression, and again, it's so simple, but we need to open up the chest. Moms spend so much time hovered over baby, feeding, changing, and you see moms just with the hunchback. And that, just having your chest closed in can create depression and can make it even worse. So as often as you can, after you feed your baby, you want to open up your arms and you want to just put your thumbs up and stretch out and open up that chest area and just breathe in and put your thumbs down and breathe. And then if you go by a door jamb, a good thing to do is to just put your arm up against the door jamb and just stretch it out. And you can feel that whole chest area open up. Do it on both sides. And just if we can take time every day, often, a few times a day, to just open up that chest, it's going to really help you combat that hunching over that you feel when you're a new mom and have that baby. Other things, just simple things to do, are to get outside, go for a walk, and you should get that 150 minutes of exercise every week. And it needs to be some good cardio exercise. So start gently at first, walking, and then if you want to jog with the stroller, do some interval training, do that. Work on squats, and you can do lunges. but that's probably like at 4 weeks, 5 weeks, 6 weeks. Work those things in, and I would say to join a fitness class, or just try to join a new parent support group and get outside. Grab your partner, grab your family, grab your baby, get outside and go for a walk. It'll make a huge difference in your psyche. And just remember, ask for help and see exercise as a tool to really help you during your pregnancy and afterwards to feel better.